With so many of our kids now able to get vaccinated, we know a lot of you parents have questions and a lot of kids might have questions. So we're working to get those questions answered for you with our Ask the Doctor segment. We want to bring in Dr. Robert Leverence. Dr. Leverence, you're the Chief Medical Officer for UT Health Physicians at UT Health San Antonio. Thank you for joining us this morning.
Thank you, Alexis, for having me.
There are kids at home getting ready for school right now who might not like shots. So can you tell them what the shot will feel like, and what would you tell them if they're worried about getting it?
Well, that's a great question, Alexis. We've had a lot of experience now with these COVID vaccines. By and large, most of their parents will already have had the exact same vaccine. It's the same dose, it's the same procedure. It's really not much different than getting other shots like their tetanus shot. Of course, no kid likes a shot. But this is the gateway now for them to gather with their friends, to play sports, to travel, to meet again with family members, and now not to have to wear a mask. It's really getting their life back. So I hope this will be an easy sell, because we need to vaccinate our kids.
What can you tell parents or kids that have questions about potential side effects?
Well, there's all kinds of resources for that, to get onto the CDC website or our own Metro Health website here. But as we've discovered with adults, side effects are really quite uncommon. With the second shot, yeah, they may feel achy, have a low-grade fever, but those are short-lasting. There's really no long-term side effects from these shots other than protecting us from the virus.
Dr. Leverence, I want to ask you about dosages, because now that it's open to 12 years and older, some 12-year-olds are still really little. Others are the size of their parents. Every child hits puberty at different times. So will they all get the same dose?
They will, and it really doesn't change in regard to adults. I mean, we have adults who are, 300, 400 pounds, and yet we have 90-year-old people as well. Most vaccines aren't dose dependent in how they're given. Now, once we get the approval to give this to young children and babies, I suspect the dose will be changed. But for a 12-year-old, even if there's 70, 80 pounds, it'll still be appropriate. We have good data now to show that as well.
A lot of parents are trying to carefully time this out and back time from vacations, because it's a 2-shot vaccine and you have to wait 3 weeks before your second dose. So what if a parent wants to get vaccinated now, but they're going to be out of town with their child 3 weeks from now? How big of a window is it that you have to get that second dose past the 3-week recommendation?
Well, that's a great question. The data all is focused on the 3 weeks, but what we've done is when folks come is if they come late, we give them the second shot, and by and large, we feel they're quite well protected. Even with the first shot, the protection is in the 90+% range. So ideally, they do want to time it around the 3 weeks. I think most of the time that can be accomplished. Even if you get the second shot at a different place, most vaccination centers are willing to do that now. Alternatively, if you do get the shot a couple of weeks late, the effectiveness still is felt to be strong, and it's best just to get it.
What would you tell a parent who's watching right now and is hesitant to vaccinate their child?
Boy, this is critical not only for the child, but for your family as a whole and your community as a whole. It's taking care of all of us together. Even though most children rightfully do well with COVID, kind of like the healthy Yankees baseball players, most get minimal symptoms or no symptoms for the children. Some children don't do well. If they have a chronic illness like asthma, they may not. And on rare occasions, they can get this multi-system inflammatory syndrome, which is quite severe. And your child may be healthy, but their cousin may not be, and susceptible. So we do ask that parents, just like themselves, by and large, have gotten the shot, give it to our children as well. That'll bring us one step closer to herd immunity as well, and bring us back to a more normal existence.
Dr. Robert Leverence, Chief Medical Officer for UT Health Physicians at UT Health San Antonio. Thank you for joining us and answering our questions.
You bet, Alexis. Thank you.